Good day to you all. Our group, Student Nursing from St. Pusing University College of Nursing, will conducting an interview to a priest and a nurse on their opinion about nursing informatics. This interview will enhance our knowledge on how nursing informatics will help patients as well as nurses.
Good day. Today, as we have Father Rene Azuero from San Vicente Ferrer Parish. Thank you for your time, Father, with us today. First, we'd like to know a little about yourself.
Father Rene Azuero from San Vicente Ferrer. So this is my first year here. For 2 years, 2011 to 2013, and then May 2013 I was transferred here. So already 11 months, almost 11 months. So I worked here as one of the pastors. Yes, we work as a team. So we have our eyes on this for the moment.
Okay, Father. We are here because we want to know about your personal opinion about nursing informatics, the technology that help the patients, help intervention, and as well as the nurses in documenting data in the computer.
Well, I understand very well. I support that idea, no? To systematize data, information, I understand very well because when I was working in hospital, we encourage this. We wanted to systematize the hospital by using computerized data because this is really needed rather than just writing. Although we have still the books, and yet we still have also computers in hospital. So I support the idea to systematize, to computerize data in hospital, especially for the records of the patients. Not only the records of the patients, but also even the financial for the
That's all. So, thank you, Father, for your time.
Today with us we have Nurse R.C. Toka from Sacred Heart Hospital. Thank you for taking the time with us today. Before we begin, first we'd like to know a little bit about yourself. First, where did you graduate?
I graduated from St. University batch 2009.
So how long have you worked here as a nurse here at Sacred Heart?
Been working here for almost 5 years. Like after a medical exam, I volunteered for a couple of months or 3 months, and then got hired as a regular staff nurse.
So can you explain to us any experiences or responsibilities that you have
Actually, if you handle two departments like operating room and delivery room, you've got a lot of responsibilities to take care of. So, as an OR nurse, you are responsible, or you have two tasks actually. You can be the scrub nurse and the circulating nurse. So, as a scrub nurse, you are the main responsible indirectly assisting the surgeons in some surgeries. So you are more likely focused on the instrumentation itself and keeping your field sterile. Okay, and then while you are the circulating nurse, you are then responsible for the paperwork or the data of the patient. And very important is that also to watch the field and keep it sterile, and also the information, as I've said, information of the patient, and you have to introduce the patient, the possible outcome of the surgery, like estimated blood loss. We call that data, or the part there, the World Health Organization's surgical timeout. So every before the operation starts, we need to, or the circulating nurse has to do the surgical timeout. And also, after the case or the surgery.
Okay, well, thank you for sharing for that. So we're actually here today to learn more about nursing informatics. So to you, how would you define nursing informatics?
Okay, since you're here in the Philippines, so I would say we are not really into nursing informatics, but based on my own idea about it, I guess it's more on the use of computer science or the application of technology, especially at this age, to nursing practice. I'm not really sure about it.
Can you explain maybe like the importance how nursing informatics is used regarding to health?
As I've read on some articles and also in some researches, I guess it is important because it could lead to a more effective nursing care, and also it saves time as well. Like you don't have to do all the paperwork there. Yeah, you just have to be guided with the proper usage of technology, like computers.
Can you state maybe like advantages or disadvantages?
Of nursing informatics. Advantages, as I've said, it's time. You can make use of your time, and also you will be. What's this? It's more reliable for me because when you use the computer, then once it's there, like at one OR theater, so you can just open it up, type the name of the patient, and you can see all the data, the status of the patient pre-operatively. So you would know, and also, of course, like for example, the medications the patient should take. Yeah, during operation.
Okay, and lastly, based on your own personal opinion, do you think nursing informatics is effective in the health setting, hospital?
Yeah, I would say yes. It's effective because I think in some other countries like the Western countries, they are already applying it for some years now, and until now they are into it. So it's really effective. Like here in our settings here in Sacred Heart Hospital, we don't actually have it yet, but there were stars before that they are planning to have it. But then I guess I don't know yet. I'm not sure.
Okay. Well, actually, that concludes our interview. So thank you again, Nurse RC, for our interview. That concludes our interview. Thank you.
Thank you.
Wait, there's more. Not only the priest and the nurse has an opinion about nursing informatics, how important to us. Nursing informatics, it enhances and improves quality of patient care.
Informatics for me is very helpful because as what I have experienced in the past 2 years, that it really helps with the personnel, from the nursing staff to the doctors and even the aides, the nurses, it really helps because after you take the vital signs, instead you put it in the paperwork or chart that you just go through by scanning with the ID band, and then it pans already in the handheld computer, and then it goes through, and the doctor or the nurses check how's the status of the patient. You can see it right away. How is the vital signs look like? And then I think one of the best things that it will happen in the nursing informatics when Philippines will gonna adopt it, and then use it every hospitals, the nursing staff and everybody in the hospital, because even the priest they just go through the patient's chart by getting into the computer at the nursing station, and then they will find, priest will find the patient's name, or if the patient was referred the priest, and also even the medication, the doctor just doesn't write it away on the paper, but then just type it in the computer, and then it send it to the pharmacy.
Nursing informatics simplifies and enhances documentation using advanced computers and information technologies.
Nursing informatics is the way to improve information. Nursing informatics improves information management.
Nursing informatics facilitates integration of data.
Pangarap kong isang araw mahanap muli ang daan tungo sa bayan kung saan paraiso ang pakiramdam.
Sige.
Ito na nga ang araw na yun. Alam ko na kahit noon pagkasa'y di malayo, dahil may ngiti sa iyong puso. Taga raw na sa Pinas, mga smile lumalabas. Taga raw na sa Pinas, mga smile lumalabas. Pinasmile mo kami parang araw matapos ang ulan.
Yeah, welcome to the Rizal Park.